Welcome to today's webinar, State Preschool Programs Annual Yearbook Update, brought to you by NCSL. All lines have been placed in a listen-only mode to provide favorable sound quality during today's presentation. It is now my pleasure to turn the floor over to Allison May. Ma'am, the floor is yours.
Thank you. Hello, and thank you all for joining us on this webinar today. My name is Allison May, and I'm with the Early Care and Education Project at the National Conference of State Legislatures. And I'm happy to welcome everyone to this webinar called today, State Preschool Programs Annual National Institute for Research Education Research, also known as NIEER, Update. I'm also joined on the line today with my colleague Matt Wire, a member of our education team at NCSL. And Matt and I are both pleased with the turnout on the webinar, and we know that this will be both interesting and informative. From looking at our registration numbers, it appears that we have approximately 35 states and the District of Columbia on the webinar today, many of whom are participants or alum of NCSL's Early Learning Fellows program. So before we get too deep into content, I'd like to familiarize you with the webinar platform. At the lower left corner of your screen, you'll see a chat box where you can pose questions at any time during this webinar. In order to build up comfortability with the chat feature and also for us to get a better sense of who is on the webinar today, I'm kindly requesting that you all enter the state you're calling in from now. Great. Well, it's great to see so many states. This is terrific. Thanks, guys. Okay. Today's webinar is part of our Early Learning Fellows program. Because the topic is so important to many, we've decided to open up registration to those that may not be Early Learning Fellows. For those that are less familiar with NCSL's Early Learning Fellows program, I want to give you just a few key points. We began in 2011, and since then we've had 6 cohorts participate in the program. The Fellows program is designed for NCSL members that are current or emerging leaders in the area of early care and education policy. And since 2011, we've accepted approximately 150 participants into the Fellows program. Some of the cornerstones of the program include building knowledge about new research and policy innovations, allowing participants to exchange ideas and solutions related to early learning, the opportunity gap, and many other issues, meeting, connecting, and learning from other legislative leaders, identifying action steps as part of a practical early learning plan for immediate use in participant states, and receiving an exclusive opportunity to speak with and learn from leading researchers and policy experts. And you can find more about it on our website, which is noted on the slide that you see in front of you. On our webinar platform today, I want to draw your attention to some helpful features. So if you look at your screen, at the top right, you'll see an icon that looks like a square piece of paper with a play button on it. As you mouse over this icon, you'll see the words, "Show me the media library." And if you click on this icon, you'll be able to access a copy of the slide deck that we're looking at now, as well as NIEER's the State of Preschool 2016 report, which will be highlighted today during this webinar. You can also find the report online. One of our goals for the next hour is to make this presentation as interactive as possible. So should you have any questions during, please do feel free to type them into the chat box. We are going to be prioritizing questions coming from our Early Learning Fellows this afternoon. Our aim will be to answer as many of the questions as possible, but if we do run out of time and questions remain, we'll get answers and send them electronically to all of you. The webinar is being recorded and will be archived, and we'll share that with you as well in the coming week. And at the conclusion of the webinar, we'll have a survey that comes up on the screen, and we're kindly asking you to take just a few moments to tell us what you thought of the webinar. Your feedback is important, and it assists us in our ability to design the most helpful and useful programming for each of you in the future. So today we're going to hear from Steve Barnett, Director at NIEER. Steve is also joined by his colleague Allison Friedman-Krause, an Assistant Research Professor at NIEER and contributing author of the report. We're also very happy to have Senator Bryce Wiggins from Mississippi, an alum of the Early Learning Fellows program, on the line. Senator Wiggins will provide some comments about pre-kindergarten in his state of Mississippi at the conclusion of Steve and Allison's presentation. And once we're done with the actual presentations, my colleague Matt Wire has a series of questions that he'll guide us through, asking them of Steve and Allison. So with that, I'll hand the call over to Steve and Allison.
Thank you. And I want to first say thank you to our colleagues at NCSL for providing us with this terrific opportunity and for the great work they do with this Early Childhood Fellows program. In addition, I want to thank everyone on the call. Good afternoon to those of you on the East Coast, and good morning to those of you on the West. The State of Preschool Yearbook is based on a survey that is funded by the federal government's National Center for Education Statistics. The purpose of the survey is to provide policymakers at local, state, and federal levels with information about what state pre-K policy is in the states and how it's evolving. And the purpose of the yearbook, which we put out, which is a separate product, is to ensure that the information from the survey is presented to the public and to policymakers in a format that is accessible and useful. And so I'm just going to show you basically a little peek inside the yearbook, what the cover of the yearbook looks like, what its table of contents look like, and just quickly go through that to give you a sense of what's in it, because state policy on state-funded preschool programs is a very broad and complicated topic. We provide an executive summary which gives an overview. We've been conducting the survey now for 15 years, and so there's quite a lot of historical data that enables us to not just present information on where state pre-K policy is now, but to present information on trends over time. And the executive summary largely does that as a kind of national overview, but then it presents key information in a set of tables. It presents state rankings on funding and on enrollment, and I should make it clear, those are not, we don't assign rankings at NIEER. Those are simply the putting the data in order. So the state that has the highest percentage of 4-year-olds is one, and the state that has the lowest percentage is at the end. And so those rankings are not assigned. That's just what the data say. The quality checklist sums are the number of items on the out of the 10 that we highlight in the report, 10 key policies relating to the quality of the program. And again, that's not a score that we assign. It's merely the number of those policies that meet benchmarks. And that is where the Institute does come in, because we do set these benchmarks for what we think is the minimum policy standard that we think research indicates is needed in order to have an opportunity to produce good results for kids. And so there are tables with the rankings quality checklist, access stunts enrollment by state, how these have changed over time. We also provide information by state on preschool special education and Head Start enrollment. That's not data that are in the survey. It's data that are obtained in addition to provide further context on the other early childhood programs in a state. Quality standards I already discussed, and then resources are basically how much money is the state spending, how much money is the state spending per child. The executive summary also explains what qualifies as a state pre-K program. It's not every early learning program that a state might fund, but it's focused on those that have an educational purpose. Then there are profiles provided for each state. So each state has its own pages in the report that describe its program and indicate where that state sits in terms of its rank with other states. We then we provide some further information about the methodology. And then the appendices to the report are where basically all of the data items from literally hundreds of questions about state policy are reported. So if you really want to get into the details of state policy, it's there. We also make available electronic data files to anyone in a state who would want to use those, not just for the current year, but going back 15 years. And we encourage state legislators to have their the agencies that provide them with information use this as a resource. And I want to make it clear, we couldn't do the survey without strong support from the states. The states have this information. This report that we produce is as much, and the survey is as much a product of the 50 states, DC, and the territories as it is of the Institute. All right, I'm going to turn things over to Allison.
Thanks, Steve. So just a little bit more information about how we get the data for the report each year. As Steve mentioned, we do an annual survey of the people in each state who run the programs. We send them a pretty lengthy web-based survey each year, and usually in the fall. We're trying to move that up a little bit this year. The information we collect goes under three broad categories of access, resources, and quality benchmarks or program standards. The information about access includes things like geographic availability of the program throughout the state, as well as enrollment totals. We ask states to report breakdowns of the enrollment total by things like age, race and ethnicity of the children, children's home language, eligibility for free and reduced price lunch, if the children are served in public school settings or private locations such as Head Start, and how many children are enrolled in full-day programs versus half-day programs or extended-day programs. We also ask about information about who is eligible to attend the program, including what age of children are served by the program. Some programs focus on only 4-year-olds, whereas others serve a broader range of children. We ask questions about if the program is a universal program to all age-eligible children versus targeted based on specific risk factors such as an income cutoff or other things like IEP or homelessness. The information on resources primarily deals with the amount of money that is spent on the state-funded preschool program and the source of that funding. So we ask states for the amount of the state funds that support the program, and we also ask if they can report information on if federal and or local sources are used to also support the program in addition to the state funds. We like to find out if a local match is required or if funding is based on a school funding formula or school finance formula. And then the bulk of the questions really are about program standards, that inform our quality benchmarks. So things like qualifications for teachers and assistant teachers, professional development for teachers and assistant teachers. We'll get into that a little bit more later as we delve more into the benchmarks. And to foreshadow what's to come later, this year we introduced the first major revision to our 10 quality standard benchmarks. So we provided 2 totals, one for the current set of benchmarks and one for our new set of benchmarks. This year we had 59 programs, 59 state-funded preschool programs in 43 states and the District of Columbia. We also had 1 program in Guam this year, so Guam was our first territory to be included in the report. Indiana's program moved from a pilot in last year's report to sort of full inclusion in the 2016 report. And the 2016 report was the first time we included California's transitional kindergarten program. However, there's still 7 states as of 2016 report that did not provide state-funded preschool at all. Montana was one of them, but they did have a small preschool development grant. And this was the first year of full implementation for the federal preschool development grants that cover 18 states, and we included questions on the PDG grants, including enrollment and spending levels for those in the yearbook survey this year. So just to preview our findings, we did see some small continued increases in enrollment. We've, over the past several years, really seen modest increases in enrollment, mostly driven by increases in the number of 4-year-olds rather than 3-year-olds. The enrollment increased by only 1 percentage point of 4-year-olds this year, so we really see pretty slow growth. We saw some improvements in quality. Namely, Maine met 4 additional of our quality standard benchmarks this year due to policy changes implemented in the state. Pennsylvania's pre-K counts program also met 2 additional benchmarks, and Vermont's new universal preschool program met 1 additional benchmark this year. But we did also see some programs no longer meeting benchmarks that they did meet previously. State funding per child increased above pre-recession levels for the first time this year. And this is also the 3rd largest increase in spending per child we've seen since over the last 15 years. However, just a caution that the average state spending per child is still less than $5,000 per child, which is lower than where we would like to see it. We also noticed a trend of growing inequality over the past 15 years. Progress has been quite uneven. And geography remains an important determinant of access to high-quality state-funded preschool programs. Notably, as some states continue to make progress each year, we see increasing inequality between those states that are moving forward and those states that have really not made any progress in the last few years.
Well, this is Steve again. One thing that really stands out in looking across the data, and I wish I could take you through state by state, but in lieu of that, a few comments about just how bipartisan support for pre-K is. Clearly this year, states were made in both red and blue states, defining that in a variety of ways. For your purposes, we focused on partisan control of or legislative majorities in the state legislatures, and so I think it's notable that 6 of the top 10 states for enrollment, 6 of the top 10 states for the percentage of 4-year-olds enrolled, have a Republican governor and legislative majorities that are Republican. The others either have a mix or of Republicans and Democrats or Democrats. 4 of the 5 states that meet all of the 10 benchmarks that we set for minimum quality standards have Republican majorities in both houses of their legislatures. So clearly, there isn't a partisan ownership of pre-K, and in particular high-quality pre-K, as an issue. And we think for America's children that's a good thing. Now, to take you a little bit more into the details, at present, just under a third of 4-year-olds nationally are enrolled in pre-K, in state-funded pre-K. That's a big change since 2002, when we started collecting data. That's more than double. But the growth rate is, over this period of time, is about 0.5% per year, and especially since the Great Recession in 2010. And that means it would take us a century more, 100 years, to add 50% more of the kids and essentially get up to 100% enrollment in state pre-K. That's a very, very long time horizon. And that doesn't add 3-year-olds. About half of the enrollment increase in this past year was due to the federal preschool development grant funding to states, and I think that's an indicator of how important that particular federal incentive for states to invest in pre-K is. All states did not move forward. 8 states actually decreased their enrollment in state-funded pre-K at the same time that 33 states moved ahead. And as I said earlier, the preschool is mostly for 4-year-olds. You can see we're only serving 5% of the 3-year-olds in state-funded pre-K. If we look at funding, as Allison noted earlier, funding is up substantially. It's not in real dollars yet back up to its level in the early 2000s, but it has recovered substantially from the hit it took during the Great Recession. Total funding has increased to almost $7.4 billion. That's an 8% increase in real dollars over the previous year. It's a substantial increase in funding per child. Again, this picture was quite uneven. State funding per child increased in 25 states. It dropped in 19. And so, again, you see this pattern in pre-K. Everyone's not necessarily moving forward every year. If we now move on to the quality standards checklist, these are our take based on the research of the minimum policies needed for quality pre-K. They aren't a guarantee. I think as all of you in state government understand, you can set standards and give people resources. That doesn't mean that implementation is necessarily what you would like it to be. And of course, you can also set high standards and not provide the necessary resources, which makes implementing them well even more difficult. And so, if we go down the list, the one that we start with is whether there are comprehensive early learning standards. That is, standards for what children should learn, standards for what teachers should do across the broad range of domains in child development. And every state pre-K program now has those. And that is not where we started, and that's a substantial change. Second of these is whether teachers of 3- and 4-year-olds are required to have the same level of college degree as teachers in kindergarten through 3rd grade, a 4-year college degree. And you can see that 35 of 59 states do that. The third is that teachers ought to have specialized training in how to teach preschool kids, so that they have knowledge of the content and the appropriate methods for delivering that. The next benchmark is that assistant teachers ought to have a child development associate or equivalent credential. These are credentials that are not purely based on taking a course. They're credentials. The CDA is got a component here about demonstrating what you can actually do. The teacher should receive at least 15 hours per year of in-service. Maximum class size should be no more than 20. Staff-child ratio of at least 1 to 10. That means that we're expecting 2 adults in the classroom. It's clear from research that the key to producing strong gains for kids, particularly for disadvantaged children, if we're trying to if one of our aims is to help close the achievement gap before kids enter kindergarten, the key to accomplishing that is intentional teaching, one-on-one, individually designed or in small groups, still individually tailored to each child. It's teaching individual children. It's not teaching a class. Anyone who's been to a preschooler's birthday party, even if they haven't taught preschool, understands just how challenging it would be to have 20 kids in a classroom by yourself and try to do that kind of individualization. It's also important that there's screening, referral, and support services. One of the key functions of preschool programs is to identify vision, hearing, and health problems and to ensure that those needs are met and corrected before they create serious learning problems for the child. With respect to meals, we thought it was important to have a standard with respect to nutrition. The standard here is that at least 1 meal per day is offered. And then with respect to monitoring, as I indicated earlier, these benchmarks really aren't going to matter the way they should if they're not well implemented, and therefore we thought it was advisable for states to have someone visit and verify that programs are implementing state policy at least once every 5 years. The next slide gives you a sense of just how much change there has been in these benchmarks, in the percentage of programs meeting these benchmarks. And you can see that across the board there's been some change, all in the positive direction. But this has flattened out somewhat since 2010. Right? So most of the progress that we made was up to and shortly after the Great Recession. And then we kind of leveled off in terms of progress on quality standards. Again, if we look at, and I'm going to go back, and I want to indicate this first slide here focuses on what we call structural quality. So those are the policy standards you set in place for the structure of the program, the class size, the teacher qualifications requirements, those sorts of things. And the next is what the field calls process quality. So this has more to do with what those people with those class sizes do, and with state processes so this is the early learning standards, the professional development, screening, site visits, and provision of a meal. You can see there again, we've made some progress, but again, it seems to have leveled off, particularly after 2011. So to get back to the big picture and give you some sense of how much this varies, this map of the U.S. shows you the percentage of 4-year-olds enrolled in state-funded pre-K. The darker the color, the more children enrolled. You can see there's quite a lot of variation, and it's not particularly regional. Right? So there are in the Northeast, in the West, in the South, in the Midwest, all states that are low and states that are high. If we look at spending per child, you see a somewhat different pattern. To my eye, for the most part, it looks like the color of, which indicates the amount of spending per child, gets somewhat darker as you move north. Of course, this can also reflect differences in state costs of living. But we worry a great deal about not just those gray states out there that don't offer state-funded pre-K, but the ones that the lightest blue, because those are states that offer sometimes very substantial numbers of their children state-funded pre-K, but fund them at relatively low levels. If part of the funding is picked up at the local level, then that may not be a problem, but in some states, and I'll use Florida as an example, there is no required local share of funding. And finally, looking at quality standards, again, you can see the darker the color, the more standards, more benchmarks the state's policy standards meet. There's quite a bit of variation, and as with the other maps, you can see it really matters for a 3- or 4-year-old where you live. All right, Allison.
Allison, we can't hear you. Perhaps your line is muted?
Yep, sorry. As I mentioned earlier, and Steve mentioned earlier, NIEER introduced a major revision to its quality standard benchmarks for the first time this year. So we provided states with 2 scores, both for the current set that Steve just talked about and the new set. We left some of the benchmarks intact, so I'm going to just highlight the 4 major changes that we made. The first change was to the early learning and development standards, whereas previously we just required them to be comprehensive, covering 5 different domains of children's development. We now require them to be comprehensive, but also aligned both vertically and horizontally, so with other standards in the state for K-12 or K-3, and for infant and toddlers, as well as with child assessments. We want them to be supported by the state, so through something like providing professional development or technical assistance, and to be culturally sensitive. The second big change that we made was raising the bar on the teacher in-service benchmark. Previously, we required lead teachers to have 15 hours per year of in-service professional development. We extended this to require this requirement to cover assistant teachers as well as lead teachers now. And in addition, we require both lead and assistant teachers to have annual individualized professional development plans. And we require all lead teachers or all classrooms to receive classroom embedded support or ongoing coaching throughout the year. We introduced a new benchmark about curriculum. This is not about requiring states to have programs to have a specific curriculum, but rather about having a system in place to help programs select curriculum and provide support for curriculum implementation. The curriculum benchmark replaced the existing meals benchmark. This isn't to say we don't think meals and nutrition are still important for children, but rather we noticed that whether or not states programs met the meals benchmark really was determined by whether or not it was a full day program or a part day program. And finally, we changed the monitoring benchmark from requiring site visits once every 5 years to requiring a continuous quality improvement system where each classroom is required to receive a structured observation of classroom quality at least annually, and that information needs to be used and fed back into the classroom and to the teachers, to the program to really work to improve the quality so that teachers are getting ongoing feedback about their practices. And so when we raised the bar on these benchmarks, we did see changes in most states meeting fewer of the new benchmarks than the current benchmarks. So this map highlights just 2 of the benchmarks that proved to be the most difficult to meet. Only, I believe it was 6 programs in 4 states met the new professional development benchmark. So those states were New Mexico, Alabama, Rhode Island, and New Jersey. And we saw 22 programs met the new continuous quality improvement system benchmark. This map shows in green the 4 states that meet both the new professional development and the new continuous quality improvement system benchmark. The yellow states meet the continuous quality improvement system benchmark only, and the red states meet neither of these 2 benchmarks. So you can see that there's a lot of progress still needed in these areas. Steve?
Yeah, and but before I continue with the next slide, I want to provide a little bit of information about why we changed the benchmarks and why we did it in this particular way. Over the last 15 years, we think the evidence has accumulated that far too many state pre-K programs, even some who did well on the benchmarks, which we have been using, didn't necessarily deliver high quality and produce great results for kids. And the research has become clear that a key element in this is the extent to which states provide or facilitate support for high levels of implementation. And that includes professional development that's delivered in your classroom. Just like I was saying for kids, the real progress is made when teachers target an individual child's learning and development. Similarly, the teachers make the most progress in terms of becoming better teachers when the professional development's delivered based on how they actually teach and what they need to make the next step, and not generic, what do you need to be a good preschool teacher. And the quality improvement system is really a plan, do, review, feedback loop. We make a plan, we evaluate our progress toward it, we review that. And whether you're in state government or in business, I think everyone understands that's the key to providing high levels of quality. So that's the rationale for what are pretty major changes. Now, I wanted to show you one slide that's based on another report we have, the States of Head Start report, which is a report on what state looks like state by state. Now, we know it's a federal program, and states really have no control over their state Head Start programs. But it's delivered in every state. It's an important part of the early learning context in every state. It serves a lot of disadvantaged 3- and 4-year-olds. And unlike state pre-K, we have data on the quality of every program in every state. And we took that data and summarized it on this map. in particular, this map looks at the quality of instructional support for kids relative to a research-based threshold of 3. And the dark green states are the ones where we can clearly say that state, on average, is above the threshold. The green is where they probably are, but we don't have statistical confidence. The light red are states that are below the threshold on average, but the confidence interval, again, is wide enough they could be above or below. And the dark red, which is a lot of states, including many of the largest states in the country in terms of the number of 3- and 4-year-olds, the dark red are the states where we're highly confident that they fall below the threshold. We would like to provide that same kind of information for state-funded pre-K. We can't do that. And so we can't do that because the data are not available. What we'd like to work on over the next several years is a project to make that kind of data available so that states would know, do our programs cross the research-based threshold for providing sufficient quality to get the results we want? And how do we compare to other states in that regard? So that's just a pitch, frankly, for something that we'd like to do and that we'd like to see state support. We think this is something that a foundation or the federal government might be able to fund. If you're looking at a 50-state report about state preschool quality, we think that that's something that's logically a national rather than a state responsibility. So thanks very much. At this point, we're happy to take questions. I see that we already have a question about who controls whether a state program is at or below a threshold, and that's based on the decisions of Head Start providers in every state, but it's also based, frankly, on their federal funding levels, which you might think they'd be equal from state to state, but they're not. Some states get vastly more per pupil from the federal government for Head Start than others.
Thank you, Steve and Allison. We appreciate your comments. We're going to open the line now to Senator Bryce Wiggins from Mississippi, who is a previous Early Learning Fellow. Senator Wiggins is going to share with us some of his thoughts related to preschool, the work he's done in his state, and how Mississippi fares. So, Senator Wiggins, the floor is yours.
Thanks. Can you hear me?
Yes.
Okay. So, appreciate it. When you think of Mississippi, you usually don't think of Mississippi as leading in education, and I say that as a lifelong Mississippian. But in early education, we didn't have an early education program at all prior to 2013. And I guess in some ways, excuse me, we had the benefit, if you look at it that way, of starting from scratch. And as people probably noticed, I'm proud to say that for the last, really since we've implemented the program, for the last 2 years, where the state has met all 10 benchmarks of NIEER. And I will give credit where credit is due. The idea came from Rachel Kinker at Mississippi First, which is a nonprofit organization. So when we launched into, what we did was we put the benchmarks into statute. And so when we were in the process of drafting the law, we went to NIEER, and particularly Rachel worked with NIEER and said, here's the 10 benchmarks. And I said, let's put it into statute, and we did. And so, and the pre-K is delivered on a collaborative model, meaning it is voluntary, and it's done. Right now we have 10 to 12 collaboratives, I think, and the amount of collaboratives get based on the amount of funding. Understand that Mississippi being a deep red state, I think people could probably understand what we were up against, and I will agree wholeheartedly about the bipartisanship. We got the Republicans control all our branches of government, and it was passed with bipartisan support. And so we've met the 10 benchmarks every year for the last 2 years, been at the top, and that's something we're proud of. And what the results are now starting to come in, and Mississippi also at the same time passed the kindergarten readiness. And what the data is showing is that, kindergarten readiness assessment. And what the data is showing is that the children who are in high-quality pre-K are scoring at or above the level for being ready for kindergarten. And particularly the ones who are in the collaboratives where the high quality is, they're scoring above the ones who are not. The other thing, what we did to address the Head Start problem was we required wherever there's a Head Start program, they had to be part of the collaborative. And so what we have seen is that the collaboratives are raising the standards for Head Start. And by the way, we would not have gotten it passed, I don't think, if not for the support of Head Start, because they wanted the demand. So they actually agreed we need better standards, and so far what we've been able to determine is that it is raising their standards. You probably noticed on there the issue we do have is the amount of money. So we have really the highest standards, but we're maybe down lower in terms of funding. You can imagine budgets plus in a deep red state what that is. But here's the thing. If you go and you look at NIEER's state report for Mississippi, and by the way, I think it says 4%, and we're 2 years in, 4% of the 4-year-olds are being covered by this. But Mississippi has appropriated, I think it comes out to be about $1,700 per child. But that actually ranks us in mid part of all the states. And so my point is this: if you're a policymaker, I actually see it as you are getting a bigger bang for your buck. You're getting you're at the highest benchmarks for less amount of money. That being said, it is our desire, we're pushing for more money each year. And in a deep red state, to say that we are at the highest level, that actually make the argument easier to sell to say we need more funding. But let me say this. One of the things that we did on that, and I do not know if this is reflected in the report, but we put into the legislation tax credits. And so we said if as an individual or a company you give money directly to the collaboratives, then you get a 1-for-1 tax credit. And the first year that started out as a few $1,000s. As of the end of this past year, $1.6 million has been given across the 10 collaboratives to go to the pre-K program. That's dollars and what we said in the legislation is that for every dollar that's given, we will match it. So the collaboratives get state money and private money, and it looks like it's continuing to go up. And that has been really good because you get buy-in from the different communities. And I asked somebody why that was, in essence, why that was working. They said because the money is going right there in the community and not to Jackson to be distributed. So they have ownership in that. So with that, I will conclude on that. We're proud of it, and while we recognize we have ways to go, I do think that so far everything looks good.
Thank you.
And I will say, I see there is a question, are the collaboratives individual entities or some part of a larger organization? So to answer that question, they are individual entities. The way the legislation is set up is that any community can get together and create a collaborative, but in order to be the collaborative to even be in the running, they have to meet the 10 benchmarks. And by the way, on the benchmarks, I did not know there were new benchmarks until I got the report. I'm told that those new benchmarks can be addressed through implementation through the Department of Education. But on the collaboratives, they are independent, but and that's the key to them is a bottom-up approach. So the collaborative in the Jackson area is literally different from the collaborative in the coastal area, which is different from the collaborative in the Delta area, because they all work on the needs that they have and the resources that they have. So it's not Jackson telling them what they have to do. They're using what they have with the benchmarks.
Great. Thank you, Senator Wiggins, for those comments. We had a couple that we put together with the researchers from NIEER. The first, and this will be addressed to Steve and Allison, many states do not report preschool enrollment data by family income, race or ethnicity, home language, and many other demographic factors. Can you take a second and discuss enrollment reporting and how it might be improved to increase access and equity?
Sure. That's a relatively easy one. It's important because most state programs are targeted, and those that aren't targeted still have as one of their primary purposes ensuring that the most disadvantaged kids get a better start in school. But so if you don't know if those are the kids that are actually getting served, then it's hard to know whether you're achieving your goal. And the simple fix is to simply have the providers collect basic demographic information on kids at enrollment, or when they report enrollment data later in the year, to collect that information. And I suspect most providers already have that information. They're just not sending it back to the states. And so most likely, most states would simply have to ask for that information in order to get it. In a few places, it may be that some kind of standardized reporting form on the basic demographics of the children enrolled might be required to get it.
Great, thank you. We have a few more questions coming in, so we're working to paraphrase those. There's a question about private-public partnerships and how do you address that the communities that need the most for their kids have the least amount to give to be matched by the state?
So I'll answer that. This is Senator Wiggins. That's a great question because we face that. In short, we address it two ways. One, we put in the legislation that when the Department of Ed was in charge of implementation, that when they looked at it, they had to, and I don't like to use this word, give a preference, but they had to weight it such for what we call those needed areas. Second is the private dollars that we talked about. So, and I'll give an example. In my district, I have the corporate Chevron. Its largest refinery is in my district. Well, Chevron can give privately to the collaborative that's in the Delta, and they will get a tax credit. So that way, the collaborative, they may not have a Chevron, but they're able to get that money. And in fact, in a lot of ways, that has happened. So you're incentivizing, and remember, this is a deeply red state, you're incentivizing private businesses to honestly get out of their silos or their local areas and go support somewhere else. So what I've said is those critical areas, they need to go out and do their part, and then they go and others will do their part. I also wanted to add that to the previous question, in the local areas, the collaboratives there has to be a lead partner, and that lead partner can either be a school district or a nonprofit. Most of them are school districts. And so what you have is you have the school districts who already have that data and everything and already can handle the money and stuff. They're the ones who oversee the implementation on that level.
Thank you,
and
Senator.
I'll just add, if you have a collaborative approach like that, not necessarily formal collaborations, but a collaborative approach, local schools in disadvantaged communities have Title I dollars in amounts that others don't get. Head Start has access to federal dollars and often is good at raising private dollars as well. So
right.
You have other partners that can help out with this as well.
Right, and the Title I, what we've had, and particularly this is a reason why our Republican Lieutenant Governor, and he's voiced this, really got behind this, was because Title I dollars were not being used like they were supposed to. And so with the collaboratives, in addition to all the other reasons you want to be collaborating, the Title I money can be used like it's supposed to be. And you can maximize, you can build on each other.
Great, thank you. We have just a couple minutes, so I just kind of wanted to put this question out, and just if we could get a brief answer, that would be great. It's asking about inadequate federal funding and forcing trade-offs in services for vulnerable children. So the question is, should pre-K be state-supported for free and reduced lunch or for qualifiers? Can you kind of talk to that quickly?
Well, sure. It would be nice if the federal government built on the preschool development grant program. As already indicated, federal Title I dollars can be used for preschool programs. If they're already being used for a strong program to help disadvantaged kids, you don't necessarily want to see it taken away. So it, as was indicated, it depends on what the dollars are already being used for. So states have, most states target children from lower income families. Even the states that have universal programs often roll them out in a way that it reaches those children first. But this is the question is a concern, and that's one of the reasons that we're encouraging every state to collect data on just that, so they would know what percentage of the children they serve are free and reduced price lunch eligible.
Thank you. It looks like we're about out of time, so I just want to say thank you very much to Steve Allison and Senator Wiggins for providing such helpful information today. We will have an archived copy of this webinar available shortly on our web, and we'll be sending that around. And we'll also be asking for you to provide us some feedback on a survey. I'd like to invite everyone to participate next month in a webinar on young dual language learners. That information we'll share electronically as well. And I'll just make a small plug that in August we'll also be in Boston for NCSL's Legislative Summit. As many of you already know, Boston's a wonderful place for a conference. So if you have not already signed up, we encourage and invite you to do so by following the link on your screen. This summer in Boston, you'll discover fresh ideas and you'll learn from policy innovators and industry pioneers. It'll just be a great place to meet with some of your legislative colleagues. And then the last thing I just want to tell you, we're happy you're here, and if you have any questions, Matt and I have our contact information on the screen, and we would strongly encourage and invite you to send us an email or give us a call if if you'd like to talk more about anything. So again, thanks for everyone for joining us, and we hope to see you next month on the webinar on the 24th of August. Have a great rest of the day, everyone.